Hi everybody, my name is Sydney and I am one of the admins to the Facebook group called Baby on Board. Today's topic of discussion is medical issues and common infections that happen during pregnancy. The first one that I am going to cover today is UTIs, otherwise known as urinary tract infections. This infection affects the bladder, kidneys, and the urethral tube. So, ways that you can tell that you have one, or side effects of having one, include the constant need. I know it's very common during pregnancy to need to pee all the time, but more than usual to need to pee, like all the time. Like you just went and you need to go again, like right away. Other side effects include burning while you pee. It could be hard to pee. And just having pain in your lower abdomen as well. If you do have a urinary tract infection, it is important for you to get to a health provider as soon as possible because you do need a prescription antibiotic to get rid of a UTI. They do have to do some tests first, but if you are feeling discomfort, they may prescribe you something to take while your tests are being done. Ways to prevent UTIs include wiping front to back when going to the bathroom. Also, not holding in your pee. If you need to pee, you need to go. That's what causes the kidneys to have a UTI, is whenever you hold in your pee for too long. Another thing that you can do is if you find that you get dry during sex, it is important to use a water-based lubricant to help with, it helps with UTIs. Also, peeing before and shortly after sex can help as well. So, that's UTIs. Another common one is hemorrhoids. Unfortunately, those happen frequently. A way to avoid them is not to push too hard when you're going to the washroom, because that can cause the lining of your intestines to kind of bulge out and cause a hemorrhoid. If you do get one, you could do hot compresses. That's just taking a warm face cloth and just putting it down there on the hemorrhoid to try to make it go down a little bit. It is important that you do not try to pop them, because they won't pop. They will not. And you'll be in a lot of pain. It may feel painful anytime you use the washroom. Not to go pee, but you know, to release your bowels. Sorry, little one's getting a little crabby over here. Another common one, and very, very common, is yeast infections. Happen a lot during pregnancy. If you have a yeast infection, some side effects of that include getting very swollen, the lips of your vagina swell. Another thing is irritation during sex. It may burn to pee. That's why it's good to get checked out. It is important for you to go see a doctor if that one is very reoccurring or happens very often, because it's not good for the baby for you to have too many yeast infections. But it is safe to use some of the creams that are at the pharmacy that go inside. It's just important to talk to a pharmacist before picking one out, because some of them are not safe to use during pregnancy. So, another one that's not very common during pregnancy, but it does happen sometimes. It's happened to me during my pregnancy, and it was just a blast. I had kidney stones. Kidney stones are very painful, very sharp pain. That happens, it's usually the front on one side, so it'll be either this side or the other side over here, and it goes through your stomach to your back, and the pain comes and goes, but very sharply comes. Like, it hurts really bad, and it is important. Well, it's not necessary, but it's definitely worth the hospital trip for sure. They gave me morphine and sent me home and told me that I could take extra strength Tylenol, which is pretty much all you can take during pregnancy, unless it's morphine. But unfortunately, most of the times that people have kidney stones, especially during pregnancy, it's important for you to pass them on your own. So you have to pass them through your pee, and you just have to kind of sit there in pain for a little while. It's common to have headaches during pregnancy as well. You can take Tylenol for that. Drink lots of water. That's important, because if you get a little bit dehydrated, you can get a headache. And heartburn, also very common. What you can do for that is just take Tums, drink milk. Not much else you can do for that one. And then last but not least, leg cramps happen a lot, like almost like a Charlie horse during pregnancy. If you feel that, first thing whenever you wake up, waddle your way out of bed as fast as possible and plant your feet solid on a cold floor, or point your toes up like, oh I know baby girl, like that. See how it's kind of stretching out my calf? It sometimes helps release the pressure. Anyways, that is all for today. Hope you enjoyed the video, and we'll see you next time. Bye.